Welcome to our Mock Interview Pro Series, where today we're diving into preparing you for an ultrasound technician interview. Whether you're just starting or looking to refine your skills, we've got you covered. Let's start with how you might handle explaining complex procedures to patients. Can you share an experience where you had to break down a complicated procedure for a patient? This question is designed to see how well you can communicate complex medical information in a way that's easy for patients to understand. Here are a few pointers to help you address this question effectively. Pick a real-life example from your past experiences. Detail how you simplified the information for the patient. Showcase your communication skills and empathy. Discuss how the patient reacted or benefited from your explanation. Wrap up with a reflection on what you learned from the situation. Now, let's look at an example answer to illustrate this.
During my clinical rotation, I encountered a patient who was anxious about having a pelvic ultrasound. I took the time to explain the procedure in simple steps, using visuals to help clarify. She felt reassured and even thanked me for my clarity and patience.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for ultrasound technician. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell us about a time when you worked closely with a physician or other healthcare professionals. This question aims to assess your teamwork and collaboration skills with other healthcare providers. Let's run through some tips to tackle this question. Pick a specific situation from your history. Clearly outline your responsibilities and role. Emphasize the collaboration and communication aspects. Share the positive outcomes or success achieved. Reflect on what the experience taught you. Here's how you might articulate this in an interview.
In my previous position at a medical clinic, I worked closely with a radiologist. I prepped patients and ensured they understood the procedures. Our effective communication allowed us to quickly identify any issues and deliver faster diagnoses, which improved patient satisfaction.
Describe how you manage a situation with multiple patients needing your attention simultaneously. How did you decide who to prioritize? This question evaluates your ability to manage stress and prioritize tasks when handling multiple responsibilities. Here are some strategies to help you address this. Identify specific patients and their needs. Explain how you assess the urgency or severity of their conditions. Describe your method for prioritizing tasks or patients. Share the outcomes and any insights gained. Keep your response clear and concise. Let's take a look at how you can structure your answer.
In a previous role, I had 3 patients needing ultrasounds at the same time. I assessed who was in the most discomfort and prioritized them. I communicated with the other patients about the situation to ensure they were informed and comfortable while I worked efficiently. Ultimately, all patients were satisfied, and I learned the value of clear communication in prioritizing care.
If a patient feels uncomfortable during a procedure, how would you handle their concerns? This situational question is here to gauge your ability to handle patient discomfort with care and sensitivity. Consider these suggestions while crafting your response. Listen actively to the patient's concerns without interrupting. Acknowledge their feelings and validate their discomfort. Offer reassurance and explain what's happening during the procedure. Adjust the procedure if possible to increase comfort. Follow up to ensure the patient feels better after addressing their concerns. Here's an example of how you might respond.
I would first listen to the patient's concerns and reassure them that their comfort is a priority. I'd explain what I'm doing and make any necessary adjustments to ease their discomfort. Communication is key to making the patient feel understood and cared for.
What steps would you take if you encountered a technical issue with the ultrasound machine during a procedure? This question is meant to assess your problem-solving skills and how you handle unexpected technical difficulties. Keep these steps in mind when responding to this scenario. Remain calm and quickly assess the situation. Check the machine for any obvious issues or error messages. Politely inform the patient about the brief delay. Contact technical support if needed while ensuring patient comfort. If necessary, reschedule the procedure to provide the best care. Now, let's see how you might answer this question.
In the event of a technical issue, my first step would be to stay calm and check for any visible errors on the machine. I would communicate to the patient that there's a minor technical setback and reassure them. If I can't resolve it quickly, I would contact technical support and, if necessary, discuss rescheduling the procedure to ensure they receive the best care.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free. Just grab it below.